right. Hello and good morning, everyone. It's almost lunchtime for you. I hope you are having a great day. My name's Amanda, and I'm the Community Outreach Coordinator at the Missouri Poison Center. And with me today is the Managing Director of the Missouri Poison Center, Julie Weber. And she's also a pharmacist by background and training, and she's going to help us talk through some medicine safety for older adults. So I'm going to go ahead and jump into a couple of just informational slides. I just want to share with you some of the types of calls regarding medication that we receive from older adults or their loved ones. This is really from data that we get and collect in, of course, a HIPAA protected way. These are the types of medicine that older adults are calling us about. And most of these are medicines that could have some serious outcomes, such as there's blood pressure medicines for number 1 and number 3, things for mood, weather could make you drowsy or reduced dizziness capacity. There's also medications that we often take pretty regularly, like acetaminophen or Tylenol for pain or discomfort. And then also things like blood thinners and other nerve related medications. And so when older adults are calling for a medicine mistake, often these are more serious and more concerning because of the types and categories of medicine that they are on. So most adults over 65 and older regularly take at least 5 different medicines. And we're not just talking about prescription medicines. When we talk medicine, I want everyone to think of all the different types of medicine, including over-the-counter medicines or supplements, hormones, other types of medications. A lot of people have chronic health conditions like high blood pressure, diabetes, arthritis, high cholesterol, depression, heart disease. And so when a person takes something like a medicine and people often ask, well, medicines aren't poison. Why do I need to call the poison center for something like a medicine? I'm thinking more chemicals or household products. But really, even anything anything can be poisonous if you take too much of it, you take it in the wrong way, or you take someone else's medicine. So, for example, many people take something like a blood thinner, but that might be a concern with another medication, might be a concern with alcohol or certain food like caffeine or tea, coffee, etc. So there's lots of concerns when it comes to medicine and sort of the types of adverse reactions and errors and things that can happen. So I'm going to pass it off to Julie, who's going to talk through some of these common errors.
Great. Hello, everyone. Thanks, Amanda, for teeing me up here. So today I'm going to talk on my first mistake is you took the same medicine twice. And this is something that you can really maybe not have too serious of a problem and you think, oh, I took it twice, no big deal. Well, sometimes doubling up on other doses can be really potentially dangerous for you. And the first thing that comes to mind is just yesterday I was looking at some medication mishaps, and one was looking at a drug class called beta blockers for blood pressure control with our medical director. And we were just looking at 5 years of data. And just looking at that, it looks like there are 300 times just with this category of drugs. Every year, there's 300 double doses or some type of mistake with this medication. So that it surprised me, but not. It happens. And I get concerned when older adults double up on their blood pressure medications, especially one called a calcium channel blocker, or maybe more commonly we hear verapamil or diltiazem. When we're older, what can happen with those is just an extra dose may make us very dizzy, drowsy, or lower our blood pressure more than we would expect. Also, another medication that sometimes older adults are on are our diabetes medications. And just a double dose of some of those types can really lower our blood sugar that can run us into a problem with hypoglycemia, which we get kind of sweaty, confused, dizzy. And also, as Amanda mentioned, those pain medications. Pain medication double doses, depending what it is, but most of them can, like a Tylenol double dose, maybe not too bad. but taking more isn't going to make it better. So that's the one thing I get concerned about. People think, oh, one's good, two's better. That's not the case. And also with the pain medications that contain an opiate narcotic, those can really cause an increased drowsiness or dizziness. And then in addition to those symptoms, you could be dizzy and run a risk for a fall. So really be cautious with taking two of medications. And you're going to hear me say a lot, call. It doesn't matter what you do. Just give us a call and one of our nurses or pharmacists will help. Took the wrong medication. And I always think, oh, how could this happen? And it really can happen easier than you think. With taking a medication, so many of our bottles look exactly the same. We get them filled at the same pharmacy, and you just grab that bottle and maybe you keep it in a certain order. And today you just got a little distracted and grabbed the wrong bottle. And instead of taking that blood pressure medication, maybe you just took your medication for your ulcer or gastric upset. So definitely these kind of mistakes can happen. So be careful when you're grabbing that bottle, but also taking the wrong medication. So think about like you're on a medication for pain, such as acetaminophen, and then you go and you're not feeling so well. Kind of it's that time of year, viral sicknesses are around, and you decide you have a bit of a cough and you grab a cold medication. You really need to look at those ingredients and make sure that you're not doubling up on the same medicine. So you have taken a Tylenol or acetaminophen, and that ingredient can also be in that cold or cough preparation. So be cautious there. And then taking someone else's medicine. And when I was still working the hotline much more, I'll never forget, beyond taking like your spouse's medication, but how many times somebody in the morning is in a rush and they take their pet's medication. They have it in their hand to give to the dog, and then you maybe have a child running around as you're watching your grandchildren, or there's just so much disruption going on with the morning routine. You go and pop your pet's medication in your mouth instead of your own. So it happens. I know we have a lot of good laughs with callers when that happens, and some even bark at us like a dog, but definitely you are going to be okay once we find out what that medicine is, see what type of medications you're on, and then really figure out it to make sure there's no interactions. And usually we'll have a good outcome.
All right. I'm going to just talk through a couple different prevention tips, and then we'll go into a couple other things. So the best reminder for you to take your medicine at the right time is having a system in place that works for you. So if you already have that system, whether it's a pill box or an alarm, keep the system the same. The worst thing to do would be to change your routine and then make a new error. So if you have a system, great. If you don't, here's some other types of systems that you might be able to use. The first is a medicine log, and the medicine log stays with the medicine, and every time you take the dose, it's marked off. This could be either on a phone or on a chart, and it's a really good tip for keeping track of your own medicines. Some people like to use alarms, and there are different ones you can use on your phone or even apps you can download, and that will help you to remember, oh, it's noontime, it's time for this medication. Many people like to use things like our pill boxes or pill sorters. You see an example of that on the screen. And these are helpful for adults who are on a lot of different types of meds or varieties of medicine, because you can keep them all contained in one small area and see if you take it or not. The only time I do not love these is if they are young visitors or guests in your home. And of course, we would want to make sure that's put away and out of sight, because there's no child-resistant packaging anymore. So great for organizing if you have no young guests or visitors, but maybe something to think about when you do. Also, your pharmacist and healthcare provider can help you work on a system. There's so many different types of things you can do. And then the last one that I think probably is something that's might be the most helpful is to sync it with a routine task. So for example, if you take a medicine in the morning, you take your medicine at the same time every day, such as, oh, I'm brushing my teeth now. Now it's time for this medication. Or I'm getting ready for bed, putting on my pajamas. Now's the time for my nighttime medicine. So the routine task, as well as the chart or alarm, can help you to make sure that your medicines are taken appropriately. All right, I'll let you take over, Julie.
All right. Lights, glasses, action. Love it. Definitely, as we get older, sometimes our vision isn't as great as it was when we were in our teens and 20s. And I can't encourage everyone enough to get your glasses on to make sure you can read the label, as well as even turning on that light. I know during the night we get up sometimes and need to take something and don't want to disrupt anyone, but get the glasses on, get the lights on to make sure you can read the label, to make sure you're taking the correct medication. But also importantly is to make sure you're grabbing the right medication. Sometimes a bottle of eye drops looks almost exactly like a bottle of drops for the ear. Two totally different ingredients often, and can cause a lot of irritation if you put the wrong one into your eye. So be cautious there. Also, we often have trouble, as I mentioned, reading those labels. So if you don't have glasses and you're having trouble reading it, maybe even a magnifier. I strongly recommend calling our poison hotline number, and you can actually get a magnifying card sent to you. And it has our number right there on it in case something does happen. But also you can ensure that you can read your medicine label. And then if you do have questions, give us a call. So just like we have our own spot on the side of the bed, I know I do for sure, your medicines need to find their own spot as well. If you have other people in the home besides your spouse, grandchildren living with you, children living with you, make sure you dedicate in your medicine cabinet maybe a shelf for your medicines, then your spouse's medications, or someone else's medicine. I wouldn't mix all the containers together because, again, they look so similar. I know even sometimes pharmacies have different color lids they put on it to identify who has what color lid for their medicines versus the other person that they're living with. So again, be very careful with that. Or as Amanda mentioned, those pill planners or sorters. If you're going to both be using a pill sorter in the home, get different ones, maybe different shapes, definitely a different color. Pick your favorite color. Have your spouse or partner pick their favorite color and use that in the home to make sure you're grabbing your right medicine. So often we are having our grandchildren in our home, or our children, just anybody coming to visit for the holidays. When you get younger ones in the house, I think we have a lot of things we need to do to keep medicine up and away and out of their reach. First of all, I always recommend, I know we clean our houses before people come over often, but do we really get under the couch? Because think about it. Get down on your hands and knees and look around at a child's level. And often there's always that one tablet that's under the couch that they seem to find when they come over. So be very careful with that. Kids just love to explore. And unfortunately, if we've dropped something, they're going to find it. And immediately, with just how their habits are and how they're curious, it often goes into their mouth. And it can happen just that quickly. So also, I know a lot of times if we don't have young children in the home, we don't want to use that child-resistant packaging. It's often difficult to open, and I recommend even getting those if we don't have children in the home. It's the best way to keep us safe and to keep them safe. And you did hear I said child-resistant. It's not child-proof, and I've known grandparents to say, I handed it to my grandchild to open it for me. Don't do that. Get it again, you don't want to teach them things that they can't already probably figure out, but keep it in a child-resistant packaging. And I think one of the biggest things is to keep it out of sight and up high out of their reach. If they don't see it, they're not going to be curious to get into it. Often these young children want to imitate adults. They think the medicine may taste good, it looks good, and we just need to keep it out of their sight and in the original packaging. And the other thing too, if you do have those pill sorters, get them put away when children come into the home. And also, I recommend, just as another step, when we do have guests over, we don't know what people are bringing in the house in their like overnight bags, purses. If you have young children that are in with you during this get together, get those purses up high and out of reach too. Maybe designate a hall closet that you can get people to put their items up and get that door closed so the kids don't get curious and explore.
Right. Thank you very much, Julie. There's lots of good information and prevention tips, but one of the number one things we want to make sure you know is that you can call the Missouri Poison Center anytime. We're 24 hours, 7 days a week, every single day of the year. And I would encourage you to save that phone number in your phone early and ahead of time. The worst thing to do is to be in the middle of a situation, panicking, trying to find the phone number. So save the phone number in your phone as a contact. Request some information from the Poison Center, get a magnet or other information through our hotline, but just have it ready to go and available so you can speak to one of our specially trained nurses or pharmacists, again, 24 hours a day. That phone number is 1-800-222-1222. We wish you a very wonderful and safe holiday season and enjoy your time. Thanks, Julie.
Thank you.